Good morning, I am Dr. Rajeshwari, Senior Consultant Pediatrics, Dr.Kamakshi Memorial Hospital. I shall be talking to you about diarrhea in children. Diarrhea is a very common illness in children. When do we say that a child has diarrhea? Frequent passage of loose watery stools more than 3 times a day is called diarrhea. Passage of blood and mucus in loose stools is called dysentery. Mother tells that her baby is passing loose watery stools with a loud noise and sometimes it is foul smelling. Diarrhea is very common in the age group of 6 months to 2 years. Now, we should know what is not diarrhea in children. Frequent passage of well-formed stools is not diarrhea. Exclusively breastfed babies pass soft, pasty, semi-solid stools, which is normal. So what are the causes of diarrhea? Most of the diarrhea in children is due to viral infection. Dysentery and cholera are caused by bacteria. Children less than the age of 6 months who are given cow's milk can have loose stools due to protein allergy. It is mainly caused due to contaminated food and water. How do we manage a child with diarrhea at home? Diarrhea is a very mild illness. Don't panic. Continue breastfeeding. Oral rehydration with ORS is the best method to replace salt and fluid losses in the loose stools. How do you prepare ORS? 1 packet of ORS is to be dissolved in 1 liter of water. Smaller sachet and preparations are available which can be dissolved in 200 ml of water. Parents should follow the instructions as given in the preparation. This preparation can be used for 24 hours. Do not refrigerate the preparation. Mothers should feed the child ORS with cup and spoon or tumbler in an older child. Do not use bottles. While preparing ORS, if less water is used, the solution is concentrated and it can be dangerous. If excess water is used, then the solution becomes dilute and it is ineffective. What do we feed children when they have loose stools? Feeding the child with good food is very important because it helps in recovery of the child. Continue breastfeeds. Mothers should give their child soft, easily digested food like rice water, rice kanji, idli, idiyappam, yogurt, curd, lassi, buttermilk, tender coconut. She should give frequent small feeds around 6 times a day and this is easily digested and absorbed. Can diarrhea cause problems to my child? Yes. Diarrhea or loose stools is accompanied by vomiting, abdominal pain and fever. Loss of water, fluids and salts can result in dehydration and electrolyte imbalances. Severe dehydration and electrolyte imbalances, if left uncorrected, can be life-threatening. Dysentery causes injury to the intestine and it can cause bloodstream infection and this could be serious. Prolonged diarrhea and dysentery can affect the nutritional status and growth of the child. How does the mother identify dehydration in the child? A normal child is alert, active and interested in the surroundings. A child with moderate dehydration is restless, irritable, excessively thirsty, keeps asking for water. The eyes and mouth of the child are dry. A child with severe dehydration is lethargic, floppy, eyes are sunken, refuses to eat or drink and has less urine output. So what are the warning signs that the parents should know when they should bring the child to the hospital? If a child is passing large quantity of watery stools, if there is persistent vomiting, the child has very high fever, passing blood in stools, refusing to eat or drink, the child should be brought to the hospital. Now, what are the things the parents should avoid while taking care of their child with loose stools? First of all, please do not stop feeding your child just because the child is passing loose stools every time you feed the child. Nutrients are absorbed even in diarrhea. Please remember, loose stools will take some time to settle, so don't panic. Your aim is to prevent the child from going into dehydration. There is no medicine to abruptly stop diarrhea. Please do not use antibiotics without consulting the doctor because most of the diarrhea in children are viral and antibiotics can worsen diarrhea and can cause antibiotic resistance in bacteria. How do we prevent diarrhea in children? Mothers should exclusively breastfeed their babies up to 6 completed months and continue breastfeeding till 2 years of age along with complementary food. Avoid giving bottle feeds, drink boiled and cooled water, follow good personal hygiene, hand hygiene, immunize your child as per immunization schedule with mandatory vaccines, rotavirus and measles. So to conclude, diarrhea is a mild illness which can be effectively managed at home. ORS is the best method to prevent and treat dehydration in children. Thank you.